Okay. And then hopefully, can everybody see? Hopefully, let's see if I'll do. All right, so hopefully we can see both the screen and the slides, and I'll go back to this. Okay, so I am going to move this over here. We're now recording, so I don't know why I can't see myself. It looks like it's, there we go. I'm gonna pin myself. Then I'll go back to here. There we go. All right, so welcome everybody. Thank you so much for coming. I am excited to give this another try and have a little rematch with technology. But today we're going to be talking about sleep disordered breathing and breath retraining. So the question that Dr. Loud had posed was, can functional breathing cure sleep apnea? And we're going to try to explore that a little bit. So first things first here. Let's go ahead and go down. So a few things. First of all, thank you for being here. I'm going to have you please stay muted initially, but write down any questions that you might have. Put them in the chat if you want so you don't forget them. And I promise at the end we'll have a question and answer session for anybody that might have questions. So the first question you probably have is, why am I as a dentist talking with you about sleep and breathing? So that question goes back a little ways. I would say that over 20 years ago when I was in undergrad, I've been interested in sleep apnea for a long time. I was on the pre-med track, and so as part of that, I was doing research. And my grandpa had sleep apnea, and I would watch him in the chair and he would fall asleep with his mouth open and literally stop breathing. So it runs in my family and it really interested me. And they were doing research. We were doing research to see if we could almost teach the tongue to, or rather produce like a pacemaker for the tongue that would stimulate it to stiffen and get out of the airway so that it would help people be able to breathe if they did have a fallback and obstruct that airway. So that was back in college. And then when I graduated, I wasn't sure that I wanted to be a medical doctor. And so I had always been a dancer since the time I was 3, and I never wanted to wonder what if. And so I decided to move to New York City to dance professionally. And I met my husband along the way on a national tour of My Fair Lady. And then as time went on, we decided, okay, I'm a dancer. That doesn't last very long. I love science. And so I was going to go back into research again. And I decided to connect with a professor at NYU. And I was able to get this position where I was getting to teach the computer how to look at the breaths that were being recorded in a night's sleep and teach the computer how to recognize obstructed breaths. So if someone was having difficulty breathing, I could say, okay, that is an obstructed breath to the computer so that it could learn what that looked like and be able to score it in real time to be able to adjust a CPAP machine during the night rather than that patient having to return to their physician to have it happen. And that was cool in theory, but I really missed people interaction, so I didn't love it. And instead of staying doing that, I decided that we would market ourselves together on cruise ships. So we traveled the world and we performed for a couple of years doing that. And then it was my mom who actually mentioned, well, why don't you look into dentistry? At first I thought, that doesn't make sense. But then it turned out that it was both scientific and artistic. And so I feel so lucky to have gotten to go to the Arizona School of Dentistry and Oral Health. And from that first moment on, I was able to realize that oral health is part of your overall health from the very beginning of my training. And I'm so grateful for that. So fast forward, graduate from dental school, have kids, and as I'm learning, I never thought that the two would intersect, to have sleep apnea and have this interest with that come together with dentistry. But the more I was learning, you could see signs and symptoms of sleep disorder breathing in children. And the more I started to realize, my son has that. Like, he's flopping around with messy sheets while he's sleeping, and he's snoring, he's breathing loudly, he's not rested, he's having nightmares. He was wearing a pull-up at nighttime and not at all caring or interested in getting out of that while his little sister had already gotten out. And there's nothing wrong with that, but I was connected with Dr. Lauren Ballinger, who's a friend and an amazing pediatric dentist who is huge in airway dentistry. And she said, you know what, let me be the dentist on this and you be the mom. And she treated my son with myo brace and expanded him. But I would say within 2 days of wearing the myo brace and being able to sleep through the night and breathe through his nose, he was out of pull-ups. And it was just such a big change. And I was so grateful for that. So then we moved from Western Massachusetts here to North Carolina, ended up doing that in the pandemic. And there's been some redirection in my career here. And in that, I love Close Your Mouth by Patrick McEwen. And I picked that up again because I had given it to patients for years and started reading it. And then that led me to other books of his. And then I thought, oh, this breathing part is so important. And I wanted to be able to teach people how to breathe and give them this action point, which led me to do the Oxygen Advantage training with him. And then realize that there's also this Buteyko clinic training for breathing. And so I have done both. I've also done the American Academy of Dental Sleep Medicine mastery level so that I can make sleep appliances for patients. And I've also done Healthy Start training so that I can help the kids grow in the way that they need to and hopefully avoid these airway issues in the future, because it's never one thing. It's all connected, and anything that I can do to help and give a patient action item, I am so excited about that. Apparently this time I've got a dog in the background, so I think he sees my husband outside. All right, so hold on for just a second. Well, anyway, I don't know. The universe does not want me to do this one. Hold on 1 second. I'm going to pause. Okay, I'm back. So we're going to go to this now. So the question originally raised was, can functional breathing cure sleep apnea? And Dr. Loud asked that question, but I'm going to change it a little and ask, can functional breathing cure sleep disordered breathing? So let's go. So what is sleep disordered breathing? I love this book. It's written by another dentist, and I highly recommend it, especially if you have any sort of sleep disordered breathing. It breaks it down really in simple terms. It gives you some things to help advocate for you. So I just love it. And one of the things that it says is sleep disordered breathing is an insidious inflammatory disease that affects every system in the body. It's associated with the biggest killers in the Western world: high blood pressure, strokes, cancer, heart disease, Alzheimer's, diabetes, and even depression. So I'm certainly not saying that sleep apnea causes these things, but we do see a lot of associations. It's never one thing. And you can look at this list down here. So in the black, we have things that are related to systemic things. So I say almost all the time with sleep apnea or sleep disordered breathing, I see acid reflux or GERD go hand in hand with that. We also see high blood pressure. We see all sorts of things. ADHD in kids is sometimes mistaken because they're more active and they're trying to stay awake. You can also look at the stuff in the blue. So as a dentist, I see more tooth decay because the mouth is often more dry, and that's offsetting that balance of the bacteria. I see more gum disease. I see the teeth literally dissolving because of the acid erosion from that acid reflux that we're seeing. I'm seeing clenching and grinding because often we're trying to open up that airway, almost like CPR, to be able to breathe, and those teeth get in the way. We also see the stuff in red, which is depression and anxiety. People don't often think of that. But if you're not getting the quality sleep that you need, we're gonna see higher incidences of depression and anxiety because you need sleep. So sleep and breathing were never meant to compete. But if they do have to compete, we hope that breathing will win every time. But sleep is also very important. So where does sleep apnea fit into this, and what's the difference? So there's a spectrum of sleep disordered breathing, and that starts with normal breathing and then goes to snoring. So I'm not talking about snoring where you're stuffy, you have a cold, you're just snoring occasionally. I'm talking about chronic snoring. That is the first sign that there's some sort of obstruction that's going on that's keeping that air from flowing as easily as it should be. And then you get upper airway resistance, which oftentimes we see in young, fit females. And what's happening is that the air isn't quite coming in as well as it should. So there's resistance to breathing all night. And so these people are waking up to be able to breathe enough to be able to breathe. So they're never getting that quality sleep, and it's exhausting. So it's not true apnea where they stop breathing for up to 10 seconds, or at least 10 seconds to qualify as an apneic event where they're not breathing, but it's resistance all night. So in obstructive sleep apnea, you have mild, moderate, or severe. And the mild, this is all based on how many times an hour you stop breathing or have lowered obstructed breaths. And so it can be, for mild, it would be 5 to 15, 15 to 29 for moderate, and 30 or more. So 30 or more times an hour every night. If you have severe obstructive sleep apnea, you're stopping breathing or at least having obstructed breath. Insomnia fits into both of these. So you can have insomnia because your body is smart. So if you fall asleep and your body knows that when it falls asleep, you're going to not be able to breathe, then it's going to try to keep you awake. And so that's a defense mechanism. And if we can treat the sleep apnea, then sometimes your body will allow you to go to sleep. There's also insomnia that's related to that racing mind, the adrenaline that's pumping, and you just can't turn your mind off. And that's kind of common in today's society because we have all these devices, all these demands, and our body was never designed to be in that fight or flight sympathetic mode all the time, long-term, chronically. And so that type of stress weighs on us in certain ways. What is obstructive sleep apnea? So let's look at these pictures. And I don't love this picture because if you've ever followed me or heard me speak, I'm always talking about breathing through the nose. So this picture has the mouth open, which I don't love, but if you're going to have obstructive sleep apnea, it's going to be much more likely to happen on your back because gravity is playing a role here. But obstructive sleep apnea means that there's an actual obstruction to the breathing. So you can have central sleep apnea, which is where the mind doesn't tell your body to breathe. That's a whole different story. But if it's obstructive sleep apnea, oftentimes the tongue will sort of fall back into the airway and close things off, or you could have the soft palate fall back. There's lots of places where it could get obstructed, but essentially you have a collapsible airway. And if your mouth is open, then your tongue is going to be more likely to be down, more likely to fall back into the airway, not to mention that as you open your jaw, it closes off your airway some as well. So I would love it if I could alter this picture to make the mouth be closed. 80% of people are undiagnosed. So there's so many people walking around that don't realize that they have sleep disordered breathing or even sleep apnea. And if it's untreated, it's affecting so many systems in their body and causing so much inflammation. So it would be great if we could catch these people, screen for these people, and help them get the care that they need. Now, there are 4 phenotypes of sleep apnea, and one of them really has to do with structure, and that's the PCRIT. So PCRIT stands for critical pressure, and it's essentially how collapsible is someone's airway. And so if you think about it, when you're awake, you have all these muscles because there's no bony structure in your pharynx. So you have all these muscles that help to keep stuff open, but as you fall asleep, a lot of that relaxes. And so if you have an airway that is small to begin with and likely to collapse, then you are going to have a high PCRIT, which means that you're subject to that collapsing because of the structure and how things are. There's also loop gain, which is essentially how sensitive someone is to carbon dioxide. So carbon dioxide is what gives you the signal to need to breathe or to breathe. And so as we hold our breath, the carbon dioxide builds up and will signal that we need to breathe. And if you're really sensitive to that buildup of carbon dioxide, then you're going to have a higher loop gain and you're going to be more prone to have sleep apnea. And it's a certain type. Upper airway recruitment means activation of those muscles to keep the airway open. So if you can train those muscles, for example, that's a good thing, because think of it like when you're exercising and you're getting your bicep, you know, it's going to have a certain tone even after you stop working out, and it can maintain that even while you're sleeping. So there's so many muscles that can be the same case. Or if you're having trouble breathing, do those activate to help open up that airway. And finally, there's arousal threshold, and that is about whether you're a light sleeper or a deep sleeper. So if and this is going to be related to insomnia. If you are a light sleeper, every little thing is going to wake you up. And that's so hard, because sometimes once you wake up, it's really hard to fall back asleep. And so that's where the insomnia part of it comes into play. But people who have a low arousal threshold will be more likely to have a little bit of trouble breathing, and they'll wake up to fix it. And they may not even realize that they wake up to fix it, but they never get into that deep sleep that's more restful. Now, on the flip side, you don't want to be such a deep sleeper that you sleep through not being able to breathe. So the hope, again, is that breathing will always win if it becomes a competition. But if you're such a deep sleeper that you don't arouse from having obstructed breath to be able to breathe again, then ultimately, obviously, you could die, which is not a good thing. Let's talk about what options exist to treat obstructive sleep apnea. There's PAP therapy. So that means positive airway pressure. So essentially, it's like a vacuum backwards. You have some sort of mask, whether it's covering your nose, your mouth, or both. It's usually both, or the nose. And that's going to be pushing pressure into there to help keep that airway open. And there's always going to be a pressure that we can kind of pop that airway open and allow the air to keep going through. So there's positive airway pressure that can be constant. It can be adjusting throughout the night automatically, or it can be bidirectional. So it can be one going in and one going out. Inspire is essentially a pacemaker for the tongue, where it's considered non-invasive, but obviously they do have to do surgery to place that pacemaker part that then runs up to the tongue to stimulate it to stiffen and get out of the airway. But it can be a great option for some people. And then jaw repositioning means we can use sleep appliances to basically reposition that jaw, just like you are trying to do if you're grinding a lot of times. But if we bring that jaw forward, it's almost like CPR, opens up the airway, brings that tongue forward, and interestingly enough, actually opens the airway laterally, which I don't pretend to understand, but that's what all the studies showed too. So if you can bring that jaw forward through the night, that helps the person be able to breathe too. We can do that with surgery as well. So people, not me personally, but people can bring the jaws forward to again open up that airway, and that can be a great option as well. Of course, there's also, you can have tonsils removed if you really need that, nasal surgery, all sorts of things to help. I would also say that breath retraining to establish functional breathing is a huge part of, or should be, for all of these treatments, because it's not automatic that even if you have surgery, for example, that then you magically know how to close your mouth and breathe through your nose. You may have the structure and the place now, but it takes some retraining, almost like physical therapy, to establish that functional breathing. And for some people, establishing that functional breathing can help make the other treatments so much more effective, or maybe even treat some of the things that are going on as well. So we'll talk about that a little bit more. Let's look at that modified original question again. Can functional breathing cure sleep disordered breathing? So I would never claim that it can, because sleep disordered breathing is complicated and there's still so much that we're learning about it. It's never one thing. And yet, if you can breathe functionally, which we'll talk about what that means, if you are breathing functionally during the day, then that's going to also help you be breathing functionally during the night. So trust me, at night, you are not going to be breathing as well as you are during the day. That's just a given. But if you can improve that breathing during the day, it's going to roll into the night and help with that as well. So what is functional breathing? It's breathing light, slow, and deep. So what in the world does that mean? Well, first of all, where do we start with that? There are two ways, well, one way that you can objectively measure where you're starting, and depending on whether you're talking about the oxygen advantage method or whether you're talking about the Buteyko method, there is the bolt or the control pause, and they're exactly the same thing. So essentially what you do is you sit down somewhere, you pretend that you have a string pulling you sort of straight up to sit nice and tall. You ideally are breathing in and out of your nose, and you're just breathing normally. You just, whatever your normal breathing is, you're breathing in and out of your nose. Ideally, if you can sit there for about 5 minutes doing that to get ready, that's great. Grab a stopwatch of some sort. Every cell phone has one. Go to that and then get ready to breathe in and out of your nose. And then you're going to pinch your nose, or at least hold your breath, and wait until you feel that first urge to breathe. And so sometimes it's like a little flicker in the throat. It might be a little contraction of the diaphragm. Whatever that definite first desire to breathe is, let go of your nose and see what that measurement is. See how many seconds that was. So this is not a competition. It's not to see how long you can hold your breath. It's just to see what that first urge to breathe is and how long that takes. And that's a measurement essentially of how sensitive you are to carbon dioxide and kind of your loop gain, if you remember that. So if you are over 25 seconds, that's fantastic. You are probably breathing functionally and good for you. You probably are sleeping well, all that good stuff. But if it's under 25 seconds, then most likely you are breathing dysfunctionally. And there are ways that we can help improve that and get that bolt score or the control pause above 25 seconds as a goal. And every time you increase it about 5 seconds, you'll usually notice a difference in how you feel and how you sleep. What can we work on? First of all, we want to be nasal breathing at all times. So the nose is designed to breathe and the mouth is not. So there are no functions that the mouth serves in order to breathe. It's meant to be for chewing, swallowing, and talking. The nose is going to be breathing and it's going to be smelling stuff. That's what it was designed to do. So let it do it. Just because we can breathe through our mouth doesn't mean that we should be, because breathing through the nose conditions the air. So it's going to be filtering the air. It's going to be humidifying it. It's going to be getting it ready to go into the lungs, and having all that stuff filtered out of it with the mucus and the turbinates and all that stuff is going to reduce the airway inflammation. So if there's less inflammation in the airway, it's going to be bigger. It's also going to harness nitric oxide, because we produce nitric oxide in our paranasal sinuses. And not only does that disinfect the air, which is awesome, but it helps dilate the airways. So as you breathe through your nose, that goes through the system and dilates the airway all the way down. It's also going to promote correct tongue posture, which correct tongue posture is when you have your tongue up to the roof of your mouth. So one way to find it is to do a tongue click. Kids like to do that. Or you can say the letter N, and that usually puts the tongue at the right position. That's right behind the teeth and the roof of the mouth. There's something called an incisive papilla, but you don't just want the tip there. You want to try to have it suctioned up to the roof of your mouth. Now, if you have your mouth open, it's going to be very unlikely you can have your tongue up there, because it's going to be much more likely that your tongue would be down in the floor of your mouth. And that's when we see kids who have mouth open all the time. We can actually see their jaws develop in different ways. That's a whole other topic. You're going to have smaller nose holes, and it's smaller than your mouth. So that means you're going to be taking in less air. There's going to be less turbulence happening. That's going to be less likely to collapse the airway, because no engineer would ever think of a tube, which essentially is what the airway is, without considering what's going through it. So you're considering how fast is the air coming through, how much air is coming through, and if it's less air, it's going to be less likely to collapse that airway. You are going to be promoting diaphragm breathing by breathing through your nose. So if you look down and take a big breath through your mouth, you're going to see your chest rise. And that's what you're usually doing when you're really stressed. So why would we want to breathe that way? If you're breathing through your nose, Usually you'll see your stomach or kind of down in your diaphragm move with that, or at least with practice, you would be able to. And if you are using diaphragm breathing and keeping the lungs full lungs is actually going to help dilate the rest of the airway. That's been shown. And so that's one of the ways that that positive airway pressure is working. It's also going to eliminate mouth snoring. So if you're opening your mouth and you're snoring, it'll sound like this. But if you close your mouth and try to do the same thing, you can't make that sound. So just closing your mouth will actually eliminate the mouth snoring. So light breathing, what in the world is that? It actually means it's so counterintuitive, but you want to be breathing less air. So we want to be more efficient with the air that we're breathing. So instead of taking big breaths, we want to be breathing more lightly. And there are ways that you can practice that. So breathing light, for example, there's various ways that you can practice for 4 minutes at a time. For example, breathing lightly, you want to be thinking of taking in like 30% less air. You can have your finger under your nose. You can notice that that's slightly colder air coming in and slightly warmer air coming out. And you want to almost feel like you can't feel the air coming out at all. You want to breathe so lightly that you'll almost feel like you're not even making those little nasal hairs move at all. And so it's an interesting feeling, but it's described as like a air hunger. And the more that you can get used to that, the more you can sort of reset that sensitivity to the carbon dioxide. And there's various ways that you can do it. You can hold one nostril, you can have your hands like this, you can have it like this, and that's all stuff that we can work on. But breathing less air reduces carbon dioxide sensitivity, like I said, which helps to lower your loop gain. It decreases the amount of air in the system, so you're breathing more likely, and so that, breathing more lightly, which is going to be less likely to collapse that airway. So if you have a high peak rate, it's going to make that less likely to collapse because you're not having as much air come in as quickly and as forcefully. And it helps to normalize both our rate and volume of breathing, which is fantastic. If we can get used to breathing normally, that's going to translate, if we're doing that during the day, to night. The slow breathing. Breathing slowly is going to reduce your carbon dioxide sensitivity. It is going to slow the rate of the air that's entering the system again. It's going to activate your vagus nerve, which is like the chief nerve for the parasympathetic nervous system. So your rest and digest, which is what you want to be doing. You want to be resting at night and falling asleep and triggering that vagus nerve instead of that sympathetic system that you have. You want to help to normalize your rate of breathing, and it decreases or eliminates nasal snoring. So just like we talked about mouth snoring, if you're snoring through your nose, usually it sounds something like this. And so if you breathe more lightly, you can't make that same sound. So sometimes that's really all it is getting to breathe less air and getting used to that and almost training with that during the day. But the ideal breath is going to be 5.5 seconds in, 5.5 seconds out for a rate of 5.5 breaths per minute. And that's something that comes from James Nestor's book, Breath. He kind of averaged everything. It's just an easy way to remember it, but essentially that's kind of what the goal is. Low breathing. So breathing low means using your breathing muscle. So instead of breathing up in the chest, which is usually what happens if you're breathing through your mouth, you want to be breathing with your diaphragm. So I describe that kind of like a jellyfish. So if you put your hands on the side, just like the picture, and then you picture as you breathe in, your hands go out. And as you breathe out, your hands come in. And as you breathe in, they go out. And as you breathe out, they come in. And so the reason that you're doing that is that it's drawing that breath all the way down into the lungs where the gas exchange actually happens. And if you're drawing the air all the way in and filling the lungs, it's going to help to dilate the airway again. So again, increasing the lung volume is going to stiffen the airway with that upper airway recruitment. It's going to get that air down into the lungs where the air sacs actually are for the gas exchange. It's going to activate that vagus nerve, which again is your parasympathetic rest and digest. And just to point out, when we say, a deep breath, we're not meaning a big breath. Those are different. So you can be breathing deeply while still breathing lightly. What can we do? I love how Patrick McEwen always says, if you can breathe through your nose for 1 minute, you can breathe through your nose for life. For so many people, it's just a habit. There's no reason why you can't breathe through their nose, but they're just used to breathing through their mouth. So if they can retrain themselves to close their mouth, it's going to make a huge difference. So one of the things I've talked about in the past is about taping your mouth. You can tape your mouth both during the day and at night if you want to get used to it, especially for kids, but someone who's getting used to it, it's a habit and you have to change it. So there are tons of different tapes that you can use. 3M micropore tape is one of them. There's I love the Myo tape because it goes around your mouth instead of over it, so you can still open and talk. I also love kinesiology tape. I use that sometimes, and you can cut it into strips, and then you can kind of do the same sort of thing where you put one on top, one on bottom, so you can still open up, talk. There's nothing that's going over your mouth to prevent you from being able to breathe through it, but it keeps your lips reminded to stay shut. So it's a fantastic way. Mute nasal dilators. So if you go like this and you can breathe better, then using mute nasal dilators or using a breathe right strip might help you be able to breathe through your nose more easily. And then if that does help, then maybe you need to see an ENT to see if there's a way that you can make your nose like that without having to use the dilators. X-Clear nasal spray, love it. My kids use it, I use it. And essentially it's xylitol, which is a natural sugar. We use that all the time to fight cavities too, because the bacteria that causes cavities can't eat xylitol, so it helps lower the amount of bacteria that's causing that. But it also helps, you can use it as nasal spray 2 to 4 times at a time for sprays. You can use it multiple times because it's natural. So at least right before going to bed. And it helps to clear up your nose. And the reason it also helps with sinusitis, it helps to, fight the viruses and stuff. It's just great. I love it. Myofunctional therapy is excellent. It's a way to essentially train the muscles to get stronger, to help keep that airway open. And you can also do that in the oropharynx specifically. And then there's a way that you can decongest your nose. So this is a QR code that if you point your phone towards it, you should be able to go to a YouTube video I created a while ago talking about this in case you forget. But essentially it's similar to that Bolt Scora, that control pause. You're going to breathe in and out of your nose normally. And then you're going to pinch your nose after you breathe out. And you're going to nod your head up and down as many times as you can until you feel like you have to take a breath. And then when you have to take a breath, you're going to let go of your nose and you're going to breathe through your nose. And so it'll be a big breath, but you should be able to recover in a couple breaths. And you should be able to breathe through your nose rather than having to do that sort of thing. So you do want to create an air hunger, but you're just trying to pull that nitric oxide. And as you breathe in, oftentimes you'll then be able to breathe through your nose. And you can do that 4 to 6 times right before going to bed to help open up the airway. Now, if in our method of doing Buteyko and Oxygen Advantage, we always say that if you are pregnant or if you have heart conditions, you don't want to be doing strong breath holds to stress your body. So there's other exercises that you can be doing, but this is a fantastic one that works really well. It's never one thing. We're almost done here. So here, there's so many shoulds in the world, but if any of these help and you haven't thought about them and you're having difficulty sleeping, these can be some things to think about. So number 1, stick to a regular bedtime and wake up time, even on weekends. So I know sometimes we sleep in or we stay up late, but that makes it so much harder to adapt every single week. Exercise, but try to finish at least a couple hours before you're going to go to bed so you don't have all that adrenaline pumping. Reduce your caffeine, or at least late in the day, because it does take like 8 hours to wear off. So some people say it doesn't affect them, but for me, I know not to have caffeine other than my morning coffee. You quit smoking, so many reasons to quit smoking. I know it's not easy, but nicotine is a stimulant. You want to avoid large meals or a lot of liquid late at night. So I don't know, it's really hard to sleep when you have a full belly and all your energy is focused on digesting that. And then if you're drinking a lot right before going to bed, you're often getting up to go to the bathroom. You want to avoid that's the same one. You want to avoid medications that can disrupt your sleep if possible. So, if you're taking a diuretic, if you can take it in the morning instead of at night, that might help, but always talk with your physician about that. You want to avoid alcohol right before bed. I know that's not going to be something that happens all the time for a lot of people, but you have to realize that alcohol is going to, one of the things it does is relaxes you. And so it's going to relax muscles. So if you already are prone to your muscles relaxing while you sleep and your airway is prone to collapsing, then you're going to have more, it's going to be more likely that it's going to collapse after having alcohol while sleeping. So you're going to sleep, you may help you fall asleep, but you're not going to stay asleep because you're going to have that airway collapse and you're going to wake up. Go to bed only when you're sleepy and try not to fall asleep on the couch. Have a cool, dark bedroom. Keep screens out of the room. Easier said than done. Blue blocker. You want to block the blue light if you can. If you can't sleep, get out of bed. So I'm guilty sometimes of, I can't sleep anyway, so then I get up and do work. That doesn't make any sense. You really want to try to do something that's quiet and relaxing. So leave the bed, but get a book, start to read until you get sleepy again. You want to calm and clear your mind before you go to sleep. So I know sometimes as I stop my day, I think, oh, I need to do this tomorrow or whatever. So if I have something that's by my bed where I can jot those things down instead of having to think to remember them for the next day, then that at least lets your body or your mind let go of that and be able to fall asleep, hopefully. And then if you can remove visible clock faces so that you're not waking up and going, oh, it's 2 o'clock. Oh, it's 4 o'clock. And then that kind of creates more stress sometimes too. The last thing, in review, if you think you have sleep apnea, you want to talk with your physician about getting a sleep study. That's really the only way that you can be diagnosed, and you do want to know if you have it so that you know how to treat it. Sleep apnea is largely underdiagnosed, and untreated sleep apnea is dangerous. It affects every system in the body. So 4 phenotypes of sleep apnea exist, and only one of them is related to structure. There are things that you can do to improve your sleep, including breath retraining. Options for treatment for obstructive sleep apnea include positive airway pressure, mandibular advancement appliances, surgical intervention, and breath retraining. And how you breathe during the day affects how you breathe at night. So establishing functional breathing during the day can positively affect breathing at night, and all 4 phenotypes of obstructive sleep apnea can be positively impacted by that. So now I'll see if I can stop sharing my screen. And if you have any questions, this would be the time. You can feel free to unmute yourself. And you can also just, if you have any questions and don't want to ask me here, feel free to send me an email at casey@drcaseyjones.com. Follow me on social media at Dr. Casey Jones if you want to see the stuff that I share about breathing. And this QR code should take you to my YouTube channel, which has some videos on it and stuff, and I will post this one there as well. So let's see if I can stop share. Okay. And so thanks guys for watching. I went a little bit better than last time in spite of the dog incident there, but thank you for coming. And if anybody has a question, I bet I can also look. I haven't checked chat to see. What did I use with my son specifically? So when we did treatment with Dr. Lauren Ballinger, first we started with the MyoBrace, which is just one tool. There's a lot of different things that you could use. So we started with the MyoBrace, and then we did palatal expansion. We used upper and lower fixed appliances specifically. And then back into the MyoBrace. And then also as part of that, I did some myofunctional therapy. I had a hygienist in the area who's also a myofunctional therapist, Nicolette. She was fantastic, and she did that with my son as well. So hopefully that helps. So MyoBrace is, there's more than one type, like I said, because Healthy Start is another thing like that. And to me, it's just a tool. So it's kind of like, I have, let me see, I have the Healthy Start example, I think, here. Okay, so I might be able to find one of the appliances here, but it's kind of like it's almost like a mouth guard for a kid. And what they try to do is make it so that it forces them or teaches them, not force them, but to become nasal breathers. And as that, it's kind of closing off the airway. It helps to guide the teeth to grow in straight naturally because you're retraining the tongue to go in the right position. Healthy Start actually has a shelf where in the habit corrector, that tongue goes up into that posture. It has like a shelf there that allows it to go up. And you're essentially trying to teach them to breathe through their nose for life and to, retrain them when they can't. And it's a soft appliance because kids are still growing. So you don't want to do anything that would prevent them from being able to grow. So let me see if this would be an example of the Healthy Start. So it kind of looks like this. And that's similar to what a MyoBrace looks like. In fact, it's probably still in my son's room somewhere, but it's really soft. And there's this little area here where the tongue sort of rests up on here. And so it goes up to that place where it should be going to learn to be up in the roof of the mouth. And it's soft. And then there's grooves and it comes in different sizes where the teeth go here. And then it basically, when it's in place, it closes that off so that they can't breathe through their mouth, they breathe through their nose, but it'll fall out. I was that worried parent who was like, if he can't breathe through his mouth, he won't be able to breathe. So I actually didn't sleep for the first night and I watched him, but when it came time and he couldn't tolerate it, it just pops out. Their kids are resilient. Anything else? Any other questions? Thanks for coming. No worries. All right, well, if there are no other questions, then I will just say thank you again for coming. I'm going to stop recording here. If I can figure that out. And yes,